Hello everyone, welcome to Try Right. This is Pack 265 and myself Srija. So today in this session you are going to learn about surgery guidelines and introduction to integumentary system in CPT coding for surgery. So what are the surgery guidelines? So first of all, what is a CPT surgical package? So when a surgeon performs a procedure, one CPT code usually pays for more than just the surgery itself. So this group of services bundled together is called surgical package or global surgery. So you cannot bill separately for the services that are already included in the surgical package. So now, why does the CPT bundle services? So because patient care varies, but most of the surgeries always involve certain routine services before, during and after the surgery. So to avoid overbilling, CPT includes these routine services in one code. So what are the services which are included in the CPT surgical package? So the first one is pre-operative evaluation and management. So this includes visits after the decision for surgery, the day before surgery, the day of surgery. This includes history, physical examination and reviewing reports. So if the visit is only to decide the surgery, it may be billed separately. So once the decision is made, it becomes bundled. And second, the local anesthesia. It includes local infiltration, digital block, that is finger or toe, and as well as metacarpal and metatarsal blocks. Topical anesthesia. So generally anesthesia or regional anesthesia, these are billed by anesthesiologist. So third one is the immediate post-operative care. It includes dictating the operative notes, talking to family and communicating with other doctors or healthcare staff. So this is considered routine surgeon responsibility. And the fourth one is writing orders. Medication, it includes medication orders, lab orders and post-operative instructions. So these are not separately billable. And the fifth one is evaluating the patient in the recovery room or post-anesthesia recovery area. Nothing but PACU. So it includes the checking patient after anesthesia, monitoring the vitals, assessing the surgical site. So this is a routine post-operative care. And the sixth is typical post-operative follow-up care. It includes normal follow-up visits, suture or staple removal, wound checks and dressing changes. So this occurs during the global period. So global period, for example, 0, 10 or 90 days. So now what is not included in the surgical package? So this can be billed separately. Complications requiring return to the operating room, treatment of the unrelated conditions, visits for new problems, services by another physician. So the diagnostic test, X-rays and laboratory test. Coming to follow-up care for diagnostic procedures. So what are diagnostic procedures? These are the procedures which are done to find out what is wrong and not to treat it. So examples like endoscopy, arthroscopy, just to look, and injection for radiography, contrast injection. So what follow-up care is included? So only care related to recovery from the procedure itself, such as monitoring after procedure, managing mild pain or discomfort, checking for immediate side effects. So this follow-up is bundled into the diagnostic CPT code. So what is not included? Treatment of the actual condition found during the test and any other existing medical problems. So this can be billed separately using E&M or the procedure codes. So there is a simple example, colonoscopy done to diagnose bleeding. So recovery observation is included and treatment of hemorrhoids found, that is billed separately. Follow-up care for therapeutic surgical procedures. So what are therapeutic procedures? Procedures which are done to treat a problem. For example, hernia repair, tumor removal and appendectomy. So what follow-up care is included? So only routine care normally expected after surgery, such as wound checks, suture removal, routine post-operative visits, pain control related to surgery. This is the part of the global surgical package. So what must be reported separately? Complications such as infection, bleeding, worsening of the disease, recurrence of the condition, new diseases or injuries, and also additional procedures. So these are not routine and need separate CPT codes. So simple example is gallbladder surgery, the routine post-operative visit which is included. Surgery for post-operative infection, it is separate billing. And supplied material, so what does it mean? So supplies used beyond what is normally included in the procedure. Examples: extra sterile trays, special drugs, special materials or devices. So how they are built? Report separately. List drugs, trays, supplies and materials used. So you have to use CPT 99070 code for supplies or a special supply code if available. And a simple example is routine gauze, which is included, and special implant or device, it is built separately again. Reporting more than one procedure or service. So when does this happen? When more than one procedure is done on the same date, same session and same operative setting. So each procedure may need separate CPT codes and also modifiers like 51, 59, etc. So a simple example is diagnostic arthroscopy plus surgical repair. So there are two lesions removed in one session. So they must follow multiple procedure rules. Post-operative period and modifiers. So during the post-operative period, that is a global period, some CPT modifiers may apply. So these modifiers explain why a service is billed separately, even though surgery already includes the routine care. So examples of common modifiers are 24, which is unrelated E&M service during the global period. 58, 78 and 79. These are the additional procedures during post-operative period. 59. Distinct procedural service. Focus of this slide. So what does a separate procedure mean? So what is the definition of a separate procedure? So separate procedure is a service that is usually a part of a bigger procedure and which is not normally billed on its own. So in the CPT code book, these codes are labeled with the word separate procedure. So what is the important rule for separate procedure? If a procedure is marked as a separate procedure, you do not bill it when it is performed as a routine part of a more comprehensive procedure. So it is done at the same time and same site because it is already included in the main procedure. So now when can a separate procedure be billed? So a separate procedure can be billed when it is independent, when it is unrelated and it is distinct from the main procedure. So in such cases, you have to use modifier 59 to show it is not bundled. And what does modifier 59 mean? Distinct procedural service. So it tells the payer that this procedure is separate and not a part of a main procedure. Situations that qualify for modifier 59. So a separate procedure may be billed if it involves a different session, different procedure or surgery, different site or organ system, separate incision or excision, separate lesion, separate injury or area of injury. So simple example for student. Example 1. A main procedure is exploratory laparotomy and the separate procedure is lysis of adhesions, which are labeled as a separate procedure in the CPT code book. So if done as a part of laparotomy, do not bill separately. If done at a different site or for a different reason, you have to bill it with 59 modifier. And the example 2, if a main procedure is colonoscopy with biopsy and the separate procedure is the control of bleeding, the same site, same routine means it should not be billed separately. If for different lesion and separate reason, you have to bill it with 59 modifier. So separate procedure means it is usually bundled unless it is proven distinct. So you can bill separate procedure only when it is done at a different site or a lesion, different session, and when it is as a independent procedure. Imaging guidance. So what is the imaging guidance? It means using images to guide the doctor while performing a procedure. So what are the examples of imaging? X-ray, radiography, fluoroscopy, ultrasound, CT scan, MRI, nuclear medicine. So this image helps the doctor to see inside the body in a real time. So when is this imaging guidance included? So if imaging guidance is already included in the surgical CPT code, you cannot bill it separately. Imaging documentation rules from radiology CPT guidelines must be followed. So proper documentation includes stored images, written report and interpretation. So now when is imaging guidance not reported? So it should not be billed when a non-imaging tracking system is used. So examples of non-imaging means radar signals, electromagnetic signals, and navigation systems without the actual images. So this do not count as an imaging guidance. So when can imaging guidance be reported separately? So imaging guidance can be built only when a real imaging modality is used, like X-ray, fluoroscopy, ultrasound, CT, MRI, nuclear medicine. So imaging is medically necessary and properly documented and not already included in the procedure code. Here is an example, joint infection with ultrasound guidance. So you have to assign the injection code as well as the ultrasound guidance code if not bundle. If it is bundled, there is no need of assigning the ultrasound guidance code. If it is not bundled, you have to assign the code. If it is bundled, there is no need of the code. So injection using electromagnetic navigation, there is no imaging guidance code. This is about the imaging guidance. So next is surgical destruction guidelines. So what is a surgical destruction? So it means destroying the tissue as a part of a surgery. So examples like burning, catheterization, freezing, cryosurgery, laser destruction, and chemical destruction. So can different destruction methods be built separately? No, usually no, because destruction is considered as a part of a main surgery. So different techniques used are not separately reported. So when can the surgical destruction be reported separately? So only when the technique significantly changes how the condition is treated. So CPT provides a separate code, a special circumstances apply, and CPT clearly lists exceptions with specific codes. So a simple example is removing a lesion and catheterizing the cautery is included. So laser destruction of a multiple skin lesions with its own CPT code is built separately. Foreign body or implant definition. So what is an implant? So implant, it is an object that is intentionally placed inside the body by a physician or a qualified healthcare professional. So it is placed for diagnosis and treatment. So common implant examples are pacemaker, stent, artificial joint, surgical mesh, screws, plates and rods. Catheters placed intentionally. So keyword is intentionally placed. So coming to what is a foreign body. So foreign body, it's an object that enters the body unintentionally. So what would be the common causes of foreign body? Trauma, accidental ingestion and accidental insertion. So the common foreign body examples are glass piece in the wound, bullet, a nail or a splinter, a coin swallowed by a child and food stuck in the esophagus. So this is an unintentionally done, unintentionally entered into the body. So when does an implant become a foreign body? So an implant is considered as a foreign body for coding when it has moved from its original position or it is broken and if no longer works as an intended or it creates a risk to the patient. So in such cases, removal is coded as a foreign body removal unless CPT gives a special instructions or a special CPT code exists for removing that implant. A simple example is example 1, pacemaker placed during surgery. It is coded as an implant. And a glass piece after an accident. It is coded as a foreign body. Broken orthopedic screw that moved and causes pain. So this is treated as a foreign body for coding. And example 4, a normal catheter removed after treatment. So still it is an implant and follows specific removal code if available. So remember, implant is always placed intentionally and foreign body unintentionally. Implant is not an accidental entry. Foreign body is an accidental entry. So implant, it is used for treatment and diagnosis, whereas foreign body, it is not used for treatment and diagnosis. So broken or migrated implant can be used, and foreign body, if it is broken, it is used for the coding. So this is about the surgery guidelines and the terms which are used in the surgery. So next is CPT coding surgery for integumentary system. The first body system within surgery coding is integumentary system. So what is integumentary system? It includes skin, hair, nails, sweat glands, sebaceous glands and subcutaneous tissue. So the main function of integumentary system is to protect the body, to regulate the temperature, to prevent the infection, sensation. So what does CPT coding integumentary surgery mean? So it refers to the coding surgical procedures performed on the skin and related structures using CPT codes. So these code ranges are mainly found in 10,000 series, 10,000 to 19,999 code range. So there are few common integumentary surgical procedures like incision, excision, debridement, shaving, biopsy. So let's go into surgery integumentary system. So this explains how surgery codes are organized in the integument system section of the CPT code book. So it tells what the headings and subheadings exist, what code ranges are included, and where to look for the special rules for instructions. So listing of headings and subheadings. So the CPT code book divides integumentary surgery into main headings and subheadings. So the main headings are the big topics, subheadings are the specific procedures. So this helps coders to quickly find the correct code. So in a subsection marked with an asterisk, that is a star, so it has a special instructions and it has a unique coding rules. So always read notes before coding these sections. So what are the notes for before the code listings? So before the actual CPT codes, you may see guidelines, special instructions and definitions. So these rules apply only to that subsection. So codes may not be in the number order. So CPT codes are listed as they appear in the subsection. So even if numbers repeat or out of the sequence. So never assume CPT codes are always numerically arranged. So the general section in the integumentary system, in which the code ranges are 10,021 to 10,012. Fine needle aspiration biopsy, which is also called as FNA biopsy. So now what is FNA? FNA is a thin needle is used, cells are in fluid or removed, and this is used for diagnosis, not for full removal. For example, needle biopsy of a thyroid nodule. So next is integumentary system. The code ranges are from 10,030 to 19,499. So this entire range is for skin and related structures surgery. So this includes the skin, subcutaneous tissue, hair, nails and glands. So the first subheading is skin, subcutaneous and axillary structures. The code range is 10,030 to 11,646. So this section includes most common skin procedures. And the key subsections explained simply is the introduction and removal. So this is used when foreign bodies, implant substances are introduced or removed. For example, removal of an implanted material from the skin. Next is incision and drainage. The code ranges are from 10,040 to 10,180. So incision and drainage, these are used when abscess, cyst, hematoma is cut to open to drain the fluid or pus. So example is incision and drainage of abscess on the back. Debridement 11,000 to 11,047. Removal of dead or infected tissue. So coding depends upon the depth like skin, muscle, bone. How much depth the drainage is done or how much depth the debridement is done. So size of the wound. For example, debridement of a necrotic tissue from the ulcer. Paring or cutting 11,055 to 11,057. So this is used for corns and calluses. For example, paring of a plantar callus. And biopsy. So biopsy means taking a sample for diagnosis. This is not for complete removal and special rules apply in these cases. So example, punch biopsy of the suspicious mole. Removal of skin tags. The code ranges are from 11,200 to 11,201. So skin tags are the small and soft growths. So 11,200 denotes the removal of up to 15 skin tags. 11,201, each additional 10 skin tags are added. So coding depends upon the number of the tags removed but not the location of the tags. If it is a removal of 18 skin tags, you have to assign both codes 11,200 and 11,201 code. Next is shaving of epidermal or dermal lesions 11,300 to 11,313. So shaving is lesion is sliced off without full thickness excision. So there are no sutures. It is less invasive than excision, and this shaving is always based upon the location and size. Example, shaving of the raised mole on the face. This is not used for biopsies or deep excisions. So excision, benign lesions. So benign lesions is nothing but non-cancerous lesions. So it includes removal of moles, cysts, lipomas and warts. So code selection depends upon the location, lesion size plus margins. For example, excision of the benign mole on the arm. Excision of the malignant lesion. So malignant means it's a cancerous lesion. For example, basal cell carcinoma, BCC, squamous cell carcinoma and melanoma. So these malignant lesions include, it requires larger margins and careful documentation. Nails, 11,719 to 11,765. So this includes procedures such as nail trimming, partial or total nail removal and ingrown nail surgery. Example, partial removal of ingrown toenail. Pilonidal cyst. So this is found near the tailbone and it contains hair and debris. So it includes the incision and complete excision. Introduction procedures, 11,900 to 11,983. So introduction procedures, these are used when substances are introduced in the skin, such as injections, fillers, collagen. Repair. So repair closures codes ranges from 12,001 to 16,036 code ranges. So this is used for wound closure after injury or surgery. So simple repair is superficial wounds, single layer closure. So intermediate repair, it involves deeper wounds and layered closure. Whereas complex repair, it includes extensive wounds and revision of the scar work. So you have to choose repair type based upon the depth and complexity but not the length alone. Next subheading is adjacent tissue transfer or rearrangement. So 14,000 to 14,350. So in this adjacent tissue transfer, skin is moved, rotated and rearranged to close a defect. For example, local skin flap after the tumor removal. Skin replacement surgery. It includes skin grafts, skin substitutes. So the subsections are definitions and surgical preparation. So this is used for burns, large wounds and non-healing ulcers. For example, skin graft for a burn injury. Skin cell suspension autografts. So in this, the skin cells are taken from the same patient, processed into a cell suspension and sprayed or applied to a wound. So the skin cell suspension autografts, these are mainly used for burns, large wounds and when traditional skin grafts are difficult. So the code ranges are from 15,011 to 15,018. Autografts or tissue culture autograft. So skin is taken from one area of the patient and placed on another area of the same patient. So there are two types of autografts. Autograft, it's a skin moved directly, and cultured autograft, the skin which is grown in a lab then applied. So this is used for burns, trauma wounds and non-healing ulcers. So no rejection risk because it's a patient own skin. Skin substitute grafts, code ranges are from 15,271 and 15,278. So artificial or biologic skin products are placed upon the wounds. For example, dermal mattresses, bioengineered skin. So these are well used for diabetic ulcers, chronic wounds and temporary burn coverage. Flaps, skin and or deep tissues. So skin is moved but still it is attached to its blood supply. So this is used for large defects, cancer reconstruction and trauma repair. Other flaps and grafts. So special or less common flap or graft techniques which are not covered elsewhere. Used when standard methods don't work and complex reconstruction is needed. So other procedures, 15,780 to 15,879 code range. So this includes scar revision, tissue rearrangement, cosmetic or functional repairs. Pressure ulcers or decubitus ulcers. So pressure ulcer, these are the procedures which are used to treat the bed sores which are caused by prolonged pressure. Common locations are sacrum, heels and hips. So this is used for debridement, surgical closure and advanced wound care. And mostly pressure ulcers are usually seen in immobile or elderly patients. So burns or local treatment, 16,000 series. So treatment of burns without grafting, which includes cleaning and dressing changes. So there are types of burns which is shown in the picture. The first degree burn, only the epidermis is burned here. Second degree, epidermis plus dermis. And third degree, it's a full thickness burn. It might be a painless. So next is destruction code 17,000 to 17,999. So destruction means destroying abnormal tissue without cutting it out. So methods include cryotherapy, nothing but freezing, electrocautery, laser and chemical destruction. So examples treated like warts, actinic keratosis and skin lesions. Destruction of benign or pre-malignant lesions. So destruction of non-cancerous or pre-cancerous skin growths. So this include warts, seborrheic keratosis and actinic keratosis. Destruction of malignant lesions. So destruction of skin cancers using any method, for example BCC, SCC, melanoma. Most microscopic surgery. So a precise skin cancer surgery which is done layer by layer, tissue by tissue. So checking each layer under the microscope. So this is used for face, nose, ears and recurrent cancers. So why it is special? Because it involves maximum cancer removal and a minimal normal tissue loss. Other procedures. So other procedures include remaining skin related procedures which are not fitting other categories. So next coming to breast. So breast CPT code range is 19,000 to 19,499. So this entire section, it includes procedures which are done on the breast for diagnosis, treatment and reconstruction. So introduction means is these codes describe the initial diagnostic breast procedures which include needle localization, image guided procedures and preparing the breast for biopsy or surgery. So the code ranges are 19281 to 19298. So mastectomy procedures 19300 to 19307. So this mastectomy is surgical removal of the breast tissue usually for the cancer. So types include partial mastectomy, total or simple mastectomy, radical mastectomy. So removal may be partial or complete. It is often followed by the reconstruction. So repair and reconstruction codes are 19316 to 19396. So in this, the procedures are done to rebuild or repair the breast after surgery or trauma. So it includes the breast reconstruction after mastectomy, implant placement and tissue flap reconstruction. Other procedures 19499. So a miscellaneous code for breast procedures that don't fit into other categories. So next is fine needle aspiration biopsy. So what is FNA biopsy? A thin needle is inserted into a lump and cells are sucked out for examination. So the cells are studied under microscope and looks at cellular details, that is cytology. So when is FNA used? When there are breast lumps, thyroid nodules, lymph nodes and soft tissue masses. Imaging guidance in FNA. So FNA can be done with imaging involving ultrasound CT and without imaging involving palpable lumps. So what is the important coding rule for FNA? Imaging guidance codes cannot be built separately with FNA biopsy codes such as 1004, 10,004 to 10,012 and 10,021. Why? Because imaging guidance is already included in the FNA codes. So why this matters in real practice means it prevents double billing, it ensures correct CPT coding and it avoids insurance denials. So reported once per lesion. So 10,004, 10,005, 10,006, 10,007, 10,008, 9, 10, 11, 12, 21. So these are reported once per session. So what does it mean? So one lesion is for one CPT code. So even if multiple needle passes are made, if multiple samples are taken, so code only once per lesion per session. So example, there is one thyroid nodule sampled with 3 needle passes. So you have to report only one FNA code only. Multiple FNA biopsies on different lesions. Same session, same day, same imaging method. So what is the rule? When FNA is done on more than one lesion using the same imaging modality, for example, ultrasound only. So the first lesion, report the primary FNA code. Second and additional lesion, you have to report the add-on imaging code. Example, 2 breast lumps biopsies using the ultrasound. So the primary FNA code is the first lesion, add-on code is the second lesion. And third guideline is multiple FNA biopsies on different lesions. Same session, same day and different imaging methods. So if different imaging methods are used, for example, ultrasound plus CT. So report separate primary codes. So you have to add modify 59 to show they are distinct procedures. Yeah, you have to add on codes. You have to use add-on codes for additional lesions. For example, lesion 1 for ultrasound guided FNA, lesion 2 for CT guided FNA. So you have to assign primary code plus modifier 59 and add-on code for additional lesion. So location does not matter here. So this rule applies even if lesions are on same side ipsilateral and opposite sides contralateral. So lesions are in the same organ, different organs, for example, thyroid plus lymph nodes. So what matters is the number of lesions and the imaging type, but not the body site and not the organ. FNA plus core needle biopsy on the same lesion, same session, same day and same imaging guidance. So if both are done on the same lesion using the same imaging, so do not separately bill imaging guidance for the core biopsy. Why? Because imaging guidance is already included in the FNA code. For example, ultrasound guided FNA. So ultrasound guided core biopsy of the same lump. So report biopsy code. So do not add extra imaging guidance code. So when FNA, one lesion plus core biopsy on a different lesion. So same session, same day and same imaging guidance, but it's a different lesion. So you can report the both in this case. Core needle biopsy as well as the imaging guidance for the core biopsy. You have to use modify 59 instead. So why? Because they are done on the different lesions. Even though the same imaging method is used, they are the distinct procedures. Example, lesion A for thyroid, you have to use ultrasound guided FNA. Lesion B, lymph node, ultrasound guided core biopsy. So you have to report FNA code, report core biopsy code, report imaging guidance for core biopsy and add modify 59 to show it is separate. Second scenario is FNA on one lesion and core biopsy on a different lesion. So same session, same day, different imaging guidance. So you can still report both. So you have to report core needle biopsy, imaging guidance for the core biopsy. Instead, you have to use modifier 59. So now why modifier 59 is required? Because this is a separate and distinct procedure. It indicates, it tells the payer different lesions, separate work and it is not bundled. So this is the guidelines regarding FNA biopsy. So this is for today's session. I hope this session has helped you. So in the next session, you will be able to learn other procedures of integumentary system which are coded in CPT. Thank you.